Hey, what's up, you guys? This is Cam Fats, aka Camgenics, coming at you on behalf of the Cam Fats YouTube channel. Thanks so much for hanging out with me tonight. So the last couple of days, I've been doing these live streams where I've been talking about the coronavirus case numbers in the state of Ohio, where I live. And I wanted to update you guys because last night we looked at some numbers. We took some screenshots of what the numbers were at yesterday. I want to compare the new numbers for today with those numbers. And we're going to see if we've had any changes, and if we have had changes, how many changes. Before I do that, though, I played a video for you guys yesterday, and I realized on playback that it didn't have any sound. I do not want to take an L on that video. I want you guys to hear that video. I want to compare it with that document that I showed you. I want you guys to see what I'm seeing. All right, so let's go ahead and go over to screen share because, hey, what's up, man? Let's go ahead and go over to screen share because I think I figured out what was wrong yesterday, why the video was muted, mostly because I'm a big dumb animal sometimes. So, but we're going to fix it tonight so you guys can hear the video that I was listening to, and we can reference that with this other data, and you're going to see how weird this thing is. So, all right, so let's go ahead and share screen. And we're going to share audio this time when we share the screen. So we'll share the screen, and we're going to come over to the video, and I'm going to play this for you guys, okay?
Everyone, I first want to start out with some of our numbers. As you know, and I apologize to the reporters here, you're going to see as these numbers go up, and some of the news of the day that our website, while we regularly post it to, it's gonna, some of that will change as
this is on March
goes
13th
people announce more at
when
the
she's
local
announcing
level.
this on March
we
13th.
Receive all that data, but it might not be. So I'm going to share with you what I know as I know it.
Now, you notice this was on March 13th, and on March 13th there was no social distancing. We have the sign language interpreter right here in the room. We have everybody bunched together. This was March 13th.
Right now, for certain, we have 9 males and 5 females. We now have an age range of cases, 34 years to 66 years of age, with a median age of 48. And their illnesses, not the case, because as we know, we started testing. Our first case was, I believe it's been a long week, Monday.
They started testing on Monday, all right? That's the key. March 13th, when we look at March 13th, we know that March 13th was on a Friday. This video was published the same day that they released this information. We see right here in the imprint of the video, March 13th, 2020, Office of the Governor. That's Mike DeWine right there. That's Amy Acton, Dr. Amy Acton, Director of Ohio Department of Health. This was on Friday, the 13th of March. She referenced just now that they started testing on Monday, the 9th. Okay.
And their illnesses, not the case.
Hear that again.
As we know, we started testing. Our first case was, I believe it's been a long week, Monday. But their illnesses started as far back as February 25th.
Their illnesses started as far back as February 25th. But they didn't start testing until Monday, March 9th. So they count the cases. They count them like when they tested. Whenever they tested, that's when they count it as a positive case. Okay, so March 9th, that's when they got their first cases. Now, if we go over here to Ohio, coronavirus.ohio.gov, this is the official website for coronavirus here in Ohio. If we scroll down here to news releases and news you can use, we go to Governor Mike DeWine, and we go to, these are all his updates on coronavirus. If we go back to his first update on this was on the 27th, okay? And here is that article I was showing you yesterday, all right? And it says right here, there are no new confirmed cases of COVID-19 in Ohio, nor any one currently under investigation for the virus. That was on February 27th. That totally makes sense, okay? because it wasn't until March 9th that they actually tested. All right. It wasn't until March 9th that they actually tested for the virus. So this totally makes sense, and it's congruent. Now, again, if I go to when was the first case of coronavirus in Ohio, I type that in. I'm going to pull back this Wikipedia article right here that will tell you the American state of Ohio was affected by the disease emergency on March 9th, when the state had only 3 confirmed cases and no deaths. On March 9th, they had tested 3 people who came back positive. All right. By that Friday, when they were doing this press conference, they were up to 14 cases. It says 13, but 9 plus 5 is 14. So there's a little bit of a discrepancy there, but either 13 or 14 cases by March 13th. Now, here's where it gets really weird. Okay. And this is what I was talking about yesterday. So if we go to here and we go over to our dashboard, we can get analytics, right? And what we'll find is that analytics don't match up, right? So if we look at March 9th, when we should have had 3 cases, what we're finding now is in our analytics, we had 212 cases on March 9th, right? That's pretty weird. On the 27th, when we shouldn't have had any cases, February, we had, now it's 16. When I showed you guys these numbers yesterday, it was 15. Now it's 16. Strange. It's changed again. If we go back to the 12th, that hasn't changed. It still has us starting on the 12th for now. 2/12/20 is when it's saying we got our first case. Doesn't make sense. Doesn't make sense, because now on the 9th, when they said we've got our first 3 cases, on the 13th, when they say in the video that we had, on the 13th, when they say in the video we had 13, 14 cases, here in official analytics, it says we now had 503 cases on the 13th. Bizarre. That's a huge difference. 503 cases on the 13th, and it says existing case count was 387. That means 387 up to 503. I mean, you're talking about, we had like over 100 new cases, that were counted on the 13th, just from that number alone. That's crazy. All right. These numbers have changed just since I showed you this stuff yesterday. They're constantly changing. Stuff that's way back here is changing. Think about it, guys. Look. All right. Just think about this for 1 second. All right. If I go to February 27th, when Governor DeWine said, we don't have any confirmed cases and we're not investigating anybody, right? That is the 27th, right? That was like almost 2 months ago. Like, you're telling me that they just got a new test result from 2/27, like today? So they inputted that today? It doesn't make sense. We just bumped up 1 case on the 27th for whatever reason. So very strange. This is the stuff I took yesterday. Okay, on the 9th. The first one I took was 2/12/2020. And we just looked at that, so we know that there wasn't any changes. Thank God. 2/12/2020, no changes. We know that. We can go back here to the 12th. We can see that on 2/12, we still got 1 case. So thank God that hasn't changed. That stayed the same. Our next one was on 2/27. Now this is what they were yesterday. Now you guys saw it was 16 cases, but look, there we were yesterday, 15 cases, and the daily case count is 2. And what that means is they had 2 new cases identified on the 27th, right? So they had 12, or they had 13, and then on the 27th of February, they're saying they had 2 more cases on the daily case count. So that 13 was bumped up to 15 on the 27th. Now, if we look what it says now, it says something different. If we look at the 27th, now it says 16 for a total case count. But still, the daily case count is only 2. So now, apparently, we had 14 cases going into the 27th, and now we have a case count of 16. So that number's changed. It's changed by 1, right? Not too big of a deal, but we can look at that and say, wow, that's kind of weird. If I I put those numbers that I added from yesterday into those 5. I just kept that. Anyways, that's not relevant for what we're doing right at this exact second. But let's go ahead. So we see the 27th has changed. All right, interesting. Let's look at 8th. I looked at the 8th and I looked at the 9th. Okay, so when we look at the 8th, we look at the 8th over here, and we see I had 5812 cases on the 8th today. 5812 cases today. 5,812 cases today. We're moving slowly towards 6,000 cases. Okay, but now if I look at what this was yesterday for the 8th, right? This taken on the 9th. We're going to see it was 5511. 5511. So minus 5511, they added 301 cases to the 8th numbers. Okay, so if I look at fluctuating numbers right here, right, the 8th, they had already added 363 cases from the day before. Another 301 cases added for the 8th. So that means the 8th alone, they have added, plus 363. They've added 664 cases on the 8th in the last 2 days. How? Why? It's crazy. The existing case count for the 8th was 5444. Now, if we look at the existing case count for the 8th, we see it was 5686. Existing case counts are shifting because they're adding numbers to all these numbers. They didn't add a number to the very first one, but they definitely added a number to the 27th, to the 27th of February. So let's take a look at the 9th. The 9th is our new day. I took the 9th. And we see yesterday on the 9th, I had 5512 recorded for the 9th yesterday, 5512. Now, if we look at it now on the 9th, it's 5876. 5876. 5,876 minus the 5512. 364 cases, man. They've added 364 cases to yesterday, today. All right, 364 cases added to yesterday's numbers. It's crazy, man. It's just. I'm going to say 364 cases added, right? It's crazy. This was on the 8th. 363 cases were added on the 9th. On 9th. Added on 10th, right? We just keep on adding more cases. I'll get rid of this. So yeah, let's keep on adding more cases, man. It's bizarre. Yeah, so that's what's happening. The cases are constantly being padded. They're constantly going up. I don't know if they're being padded or I guess they could be let me stop screen sharing for a second. Let me come back to this, okay? Okay, so I don't know if I don't know what's happening. I truly do not understand what's happening. Like, I want to give people the benefit of the doubt and think in my mind that as they get test results in, they're going back and applying changes to the days where the people were actually tested. And those changes are being applied retroactively. That's why all the new numbers are coming in. That kind of sort of makes sense, but actually it doesn't really make sense, because we shouldn't have numbers being changed on February 27th. Nobody should have been tested on the 27th and just now got a test result on February the 10th, because that's when we're talking about this was changed. This was changed today. That number was changed on February 27th. It was changed today. They added another case to February 27th today. I mean, why? Why would you add another case today from February 27th? I mean, you could say, well, you know, it's a big state. There's a lot of counties. They're getting information in from multiple places at all times. So there's some confusion and errors, and that's why things are being added late. I mean, I guess you'd have to say that. That's the only logical explanation, if you don't want to feel like they're just padding the numbers and the numbers are wrong. The numbers are wrong. The numbers are wrong. Make no mistake, these numbers are wrong. They're changing. They've added 600 numbers just to they've added 600 cases to the 8th. We're at the end of the 10th. Between the 9th and the 10th, they've added 600 new cases to the 8th. Wow, that's a lot of cases that they've added on the 8th. I mean, so the numbers are wrong. The numbers are clearly wrong on the website. It feels like history is being rewritten. But is it, like, you know, notorious? Is it conspiratorial in nature? I don't know that that's necessarily true. I just don't understand. It's troubling to me. I find it troubling as we all sit hunkered down in our houses, you know, wearing masks to the grocery store, you know, afraid to, you know, go outside because we're going to catch some killer virus or something. And to see these numbers just fluctuating like this, you know, I find it troubling, you know, and I see the narratives changing too. The narratives are changing, you know. I hear him talking about like herd immunity now. I hear him talking about like, well, maybe herd immunity is not a bad thing. Maybe we can just get back to normal. And then I hear him talking about, you know, maybe we'll never go back to normal completely. You know, maybe it's a bad idea to shake hands from now on with each other. Maybe we'll just never go back to normal. And I hear stuff like this. I hear all these things, you know, and I think in my mind, like, you know, what is this? What is happening here right now? I feel like, you know what I feel like? I feel like whenever things don't add up, you're not getting the whole picture. That's what I feel like. It doesn't necessarily mean that someone's lying to you, but you're definitely not getting all the information when things don't add up. And when I see those numbers fluctuating in those early days, that doesn't make sense to me. That doesn't add up. So I don't know. I'll tell you what I think I want to do is, maybe tomorrow, maybe the next day, I'm going to come back and I'm going to revisit these numbers, and we're going to use the 8th as a control, and we're going to use those 4 days. Those 4 days. Here's what we're going to do, you guys. Here's what we're going to do. All right. We're going to let me share my screen really quick. Here's what we're going to do, guys. We're going to use these 4 days as our control days. Okay. The 12th, when this whole thing started. The 27th, when Governor DeWine said, you know, hey, we have no cases right now, and we haven't tested any. We're not currently investigating anybody. That's what he said on the 27th. That's what he said right here. There are no confirmed cases of COVID-19 in Ohio, nor anyone currently under investigation for the virus. That was on the 27th of February. Now we know those numbers have already jumped by 1. It was 15, and now it's jumped to 16 on February 27th. So we're going to use that as a control. We're going to use the 8th, which was 2 days ago. We've already seen 600 cases added to the 8th. I must not have saved it. I must not have saved it one before. So, well, wait a second. You know what I did? Let's see. Here we go. Let me save this. Okay, so here we go. Look, we know the 8th they added 600 cases. And then, you know what we'll do? We'll use the 9th as another control. We'll use the 9th as another benchmark. So we'll see. We know 364 cases were added today to the 9th. And, you know, we'll check and we'll see how many more cases. So you know what we got to do? You know what we got to do, guys? We got to come down here and we have to add 12 2020, and we have to add 27 2020. You know, it'd be like really obvious that they added cases to the first day. I mean, it's kind of obvious anyway, because there's all these recorded events of this whole thing getting started on March 9th, and yet they're saying it got started on February 12th now. So we had 0 added cases on 4/10/20, and here we have 1 added case on 4/10/20. All right, so here's what we'll do. We'll come back tomorrow. Here's what we'll do. Let me go ahead and stop screen share. Here's what we're gonna do, guys. We're gonna come back tomorrow and we're gonna see what they're doing, right? Now this is crazy. Okay, so this is Friday. So what I think I'm gonna do, I'm going to call them on Monday and see if they can give me some kind of insight into why these numbers keep changing, right? Even the early day numbers are changing. I want to know why the numbers are changing, and I want to know why the analytics don't reflect that we got started with COVID-19 on the 9th of March. Why are the numbers saying we got our first cases on the 12th of February? You know, why is it farther back now? According to Mike DeWine, on February 27th, we hadn't tested anybody. We weren't currently investigating anybody, and we have no cases on the 27th. But now we had cases on the 12th. So why? And I want to know. I'm gonna call them Monday. We're gonna see. I'm gonna record it for you guys. We're gonna see what happens. But right now, I don't like the way it looks. It looks funky to me, you know. And I say that as someone who's hunkered down in my house, you know, going to the grocery store as little as possible, you know, canned goods everywhere, you know, trying to stay inside as much as possible. My entire family's trying to, you know, not go anywhere all the time. And, you know, you can't go anywhere. The parks are closed. Everything's closed. You can't go anywhere. You know, we're all stuck inside, and it's like this all over the world. And I'm just trying to understand, you know, a little bit about what's happening, because these numbers are just not adding up to me. So anyways, you guys give me a like, give me a comment in the comment section. Let me know if you find this interesting. Let me know if you find it also weird. If you have a theory about what might be happening other than what I said, I'd love to hear about it. Like I said, I'm not trying to like promote conspiracy theories. I am taking, you know, this virus seriously. But it's really because I don't know. I just don't know what's happening. I know that ER is very quiet in my neighborhood. The hospitals in my neighborhood are quiet. There's nobody there. I just don't know what's happening. I'm not taking it seriously. I'm not saying it's all fake and it's some kind of conspiracy. I'm not saying that. I just don't know. And I do find these numbers a little bit strange and bizarre, quite frankly. It's weird. So anyways, that's all I got, guys. Thanks so much for hanging out with me. Leave me a comment. Let me know what you think. I'd love to hear your thoughts on it. Even if they're not the same as what I think or not, it's totally okay. Just be nice to each other in the comment section. That's all I ask. Peace, everybody.